All right, welcome back to the United States Medical Association's live streaming event here at the Florida Medical Association. We have been here for the last couple of days and really enjoying our time here because we've been able to see a lot of traction, get a lot of traction with people who are just unhappy with the AMA and are looking for an alternative, which we provide in the USMA. Right now I have with me Dr. McKnight. And Dr. Ellen McKnight, and she has been making an impact and working on CPT codes and maintenance certification. And maybe you could just tell us a little bit first about the maintenance certification efforts you have, how you got into it, and then what you're doing and where it stands.
So thank you. And actually the reason I became involved with the FMA, it was in 2014 when maintenance of certification, they changed the rules and they were going to require doctors, and still want to do this, where your certification would no longer be even for 10 years, and that it would have to be renewed essentially every 2 years. This is it takes the lifetime medical doctorate and converts it into a 2-year certificate. So that is what drove me to come to organizations like the Florida Medical Association. And I have been working, I've sponsored, with the exception of this year, I've sponsored every year a resolution pertaining to maintenance of certification. And we now have some very good language and some strong protections for physicians. So I came out of nowhere. I'm a private practice doctor. I don't or didn't have a lot of influence, but I came here and started the process of sponsoring resolutions. And I do want to encourage people, if you have an issue that you're passionate about, then come and bring it to the floor of the House of Delegates, and you'll be surprised about how much you really can do to change things.
We've seen that. We've seen that with Dr. May, with Dr. Gonzalez, with others, Dr. Petit, others who have decided that they want to see changes made. And you're right. If you do it, and if you're organized and prepared, and if you can create a coalition, right? Which on a lot of these issues is not that hard because a lot of physicians don't feel like they have the voice that they need.
Correct.
And so you feel like you got the resolution that you needed on the maintenance certification?
Well, I do think we've made ground, really progress, I should say. But what I will tell you is, they're back again this year, trying to again force ABIM and ABMS certification on doctors, and they want to do it based on AMA recommendations, which is a very interesting thing, because if you disagree with those recommendations for maintenance of certification, it's AMA pushing that.
Right.
So so that will get defeated this year, I feel pretty sure.
So can you explain just briefly why they want to push it to every 2 years? What is the purpose of that?
Money. It is as simple as that.
That's just what I was thinking.
They have not proven that doing it that way improves the way we had done it for many years, which was by getting CME credits and keeping up. If I go to a meeting, I know what I need to sort of focus on in order to make me a better doctor. And so maintenance of certification, I think, has been useless, but it's a contributor to burnout in a huge way.
So the certifiers are the ones that really make all the money is by doing it more frequently.
Oh, it's hundreds of millions of dollars over time. Absolutely. Yep.
Right. Okay, then another issue that you had that you've made real inroads on are CPT codes and how those funds are used and all. Maybe you could walk us through that just a little bit for anybody that doesn't understand it, which most of our viewers will. But
so the primary reason that I put this resolution together was really education.
Okay.
Educating the physicians at the FMA and hopefully even beyond that this is even a thing. Like, most doctors have no idea that we're forced to use CPT codes in order to be paid. And the AMA owns the copyright to the CPT codes. Now, in the old days, and I've been a doctor for a long time, so I remember these days, in the old days, what they would do is sell to doctors' offices and hospitals and maybe billing departments the book. You'd have a hard copy book, that you would then refer to. And so that's how the AMA made their money on CPT code. Well, now they're not dealing with doctors' offices as they did before. They're dealing with the gigantic billion-dollar industry of electronic health record or health IT. Okay, those are who they're getting their money from, and well, I'll give you an example. The revenue brought in by what they line item as credentialing and CPT code royalties was $297 million in 2022, and the dues for the AMA were about $33 million.
Oh my gosh!
that is a phenomenal difference, and it's proven that the AMA only has less than 10%, I'm going to guess maybe closer to 8% of practicing physicians belong to the AMA. So they really don't represent us. And here's what I'll ask my fellow physicians. We have been struggling with the electronic health record now for probably 10 to 15 years. I think the AMA could have said to these companies, you know what, we're not going to sell you the rights to use CPT codes until you fix the problems that are inherent in these systems, right?
Right.
Because doctors, as we all know, I actually don't use a system like this. I can come back another time and I'd like to talk to you about what I've done in order not to have to do that. But doctors are spending 4 to 6 weeks a year, uncompensated, at night and on the weekends doing work for the EHR. Why did the AMA not use their leverage to fix these inherent problems with this system? They haven't. It is a major contributor to burnout. And I believe that the AMA is now, their judgment is clouded because they're getting so much money, and they don't really need the dues-paying doctors anymore. They don't need us.
It seems like, I mean, what we continually hear from physicians, what I hear all the time as a non-physician, I've been shocked at how much the physicians realize that the AMA's allegiance is to insurance companies, to other private corporations like you were talking about there, to hospitals often, and to government. Because those things are, well, it must be 90% of their funding probably comes from those areas and their money. And if they're only representing 8, then really it's obvious. As an old school reporter, it was always follow the money, and if you follow the money, you see what's driving the AMA, and it has not got anything to do with what's good for physicians and physicians' patients.
That is absolutely
Because what's
correct.
good for patients,
Right.
or what's good for physicians, is good for patients.
I say that all the time.
Yes,
if
right.
It's
a truism.
It's a total truism, and so it really does trickle down, so to speak, to the patient.
Right.
And so I do talk about physician autonomy. That's another thing that I'm very into, try to help doctors to break out of the current abusive system that they're in now, which is again also leading to their burnout. But I'll just quickly mention that the resolution that I have this year is to bring to that the FMA is going to research the background of these agreements. They're going to research the funding that is happening, and hopefully we'll find out how the AMA in theory is spending their money. So
awesome.
that would be very good.
They don't want that level of transparency.
They really don't. I think they want no transparency.
Right, exactly.
I think that's really the bottom line.
Right,
Yes.
right. All right, well, Dr. McKnight, thank you so much for joining us on our live stream with the United States Medical Association here at the FMA.
Thank you.
We look forward from hearing more from you, and thank you for all of your efforts on behalf of physicians who will benefit statewide.